My name is Brandon Priester. I attend the University of North Carolina, Asheville, where I'm a mass communications major. I also work part-time at Asheville-Buncombe Technical Community College in the IT department. I've been uninsured since I was around 18 or 19 years old. Most recently, not having insurance has affected my educational plan. Upon my admittance to the University of North Carolina, they brought me to the awareness that in order to take 6 or more credit hours, I had to be insured. And coming from a college where I was a student government president and served on the board of trustees, it's embarrassing to come in to the university, which you worked hard to get to, and take one class. It's definitely slowed me down in my plans for education.
My name is Sharon Levi. My husband has a master's degree from the seminary, Master of Divinity. And so we were in pastorates and churches working through the several years. Circumstances changed, so we moved up here to Hendersonville. And he finally found a job that he liked, which was more or less a manager of apartment complex. But I had a part-time job and I was working for a business lady. So basically we had no insurance, and then things changed, circumstances changed, and my husband was diagnosed with cancer in 2007. He was 56 years old, and then he had to all of a sudden couldn't work anymore. He had to go on disability, and I became his caregiver. The lady that I was working part-time for, she sold her business, so there I was without a job also. Basically, we've just been living off of his Social Security disability. So we're between a rock and a hard place.
My name is Jerry Munkus. I moved to Asheville from Fort Lauderdale in 2000. I used to be a purchasing manager, but I was laid off in 2009 and was unable to find permanent full-time employment, so I decided to go back to school. So now I'm a full-time student at AB Tech. Well, I don't have insurance, so what do I do about it is utilize the resources that are available for me in Buncombe County, and I've been going to Western North Carolina Community Health Services. Well, I signed up for the Affordable Care Act at healthcare.gov, and once I had signed up, I realized that I didn't make enough money to qualify for the Affordable Care Act. In North Carolina, the legislature here decided against the Medicaid expansion. By doing that, that left people like me, and I believe there's thousands of us, that are simply in limbo, and I just didn't qualify for any help. Scared, to be perfectly frank. It's very scary. I'm 61 years old. I am diabetic. Basically, that's my only real health issue, but I could fall. I could have a car accident. I could have any kind of thing happen. I could develop something else, and I would just be scared that I don't qualify for any kind of help other than wonderful programs like Winches.